Thank you, Dr. Gao, for coming here to Mobile World Congress and 4 years from now. We are talking in the Planet Health podcast. You are a surgeon and implementing innovation in the virtual care space. Can you explain us a little bit your experience?
Right. So thanks, Jody, for inviting me for this podcast. So, just a bit of background about myself. I'm a liver, pancreas, and liver transplant surgeon as a specialty. I'm also the Assistant Group Chief Technology Officer for the National University Health System. And in that role, my main responsibility is looking at using immersive technology in clinical applications. So moving beyond education and training into actual clinical care, using it in operating theaters, using it in the wards in the clinic. And the main area that we see this growing is essentially to increase the usability and the increased adoption of medical technology in our day-to-day activities. Yeah. So the main area that I work on as a platform is what we call Holomedicine, which is the combination of holograms and a holographic display in clinical medicine. We use the HoloLens 2 from Microsoft together with a German company called Epocla. So we are using this quite routinely in our operating theaters now to visualize patients' scans in 3 dimension. So we get CT scans, MRI scans, any form of volumetric DICOM. Using the HoloLens and VSI, we can render it into a 3 dimensional hologram, and we can use that for surgical planning before the surgery itself. And we can also use that during the surgery by superimposing the image on the patient. And essentially that gives you X-ray vision, right? You can see into the patient, you know exactly where the tumor is. You can plan your surgery according to essentially real-time spatial orientation. And we see this being a huge benefit, not just in specialties that have traditionally used surgical navigation, like neurosurgery, orthopedics, but also into specialties that previously had no surgical navigation because it was not possible. So this opens up an entire new field and a new domain for these specialties to go into. Yeah.
Thank you, Dr. Gao. Is this part of internal initiative of your department? Or do you have a transversal support from the hospital, from the government to support that?
Yes, so this essentially started as a small off-budget program. We had a one-day workshop with Microsoft when HoloLens 2 first came out. This is about 2.5 years, 3 years ago. So we had a one-day workshop with them, and then we looked at the feasibility of this technology in clinical applications. So from there, we developed a small pilot program, which we ran for 6 months in the hospital, where we went from different specialties in the hospital. We brought the device to them. We had a half-a-day session with them, essentially getting their feedback and whether or not they think that this technology is going to be useful, or is it one of those fads, I would say, that is just going to come and go. Right. So at the end of the 6 months, we gathered about 51 different applications and use cases for this technology as a platform. Okay. Right. So after that 6 months of proof of concept, we got approval from the hospital as a group to be a strategic program within the hospital to develop Holomedicine and to develop mixed reality as an integrating platform for clinical use and for clinical applications. So that's when we started looking more into the different kinds of use cases that we can onboard. We started using it in the wards more regularly. We use it to counsel patients for their surgeries. So the patients actually wear a HoloLens.
Educational purpose.
Yeah, correct. So they wear a HoloLens, the surgeon wears a HoloLens, and the patient gets to see their own scans in 3 dimension. And it really brings a whole new level of understanding the patient from the patient's perspective, and what we call informed consent. Because now they know exactly what's going to happen. We can even do like a virtual run of the surgery together with the patient and let them know exactly what we're going to cut, what's going to be removed, and we can show them what's being left behind and what's coming out from there. Right. So the whole, again, before technology platforms like this is just not possible. Yeah. Right. So we've been running this program in our hospital for the last 2 years. We are using it in 12 different departments at this point in time. In terms of funding, we have strategic funding from the hospital, and we also have funding from the government, the Singapore government, to look more into the innovation aspects of it. And this is kind of where we went into the 5G arena as well, where now we are working with the Singapore government and IMDA to deploy indoor 5G within the hospital. So we are in the process of finalizing the renovation and preparation works to install indoor 5G antennas in our operating theatres, as well as our inpatient wards, to support essentially the use cases that we foresee it's going to be coming up in the next few years. So telemedicine, all this.
So with that 5G implementation, you could really give support to external surgeries, for example.
Exactly.
Um,
Exactly.
So, with all these 2 years of implementation, have you already outcomes regarding educational purposes, efficiency, time? No,
Yes.
Do you have
Yeah.
savings or?
So we don't have any financial outcomes at this point in time because we are not actually tracking the financial ROIs, but we are looking at the clinical returns. So we have used this for about 90 plus to 100 surgeries over the last 2 years.
Okay.
And we have seen for certain cases, it actually reduces operating time by as much as 50 to 75%.
Wow.
So for example, a laparoscopic adrenalectomy, right? One of our surgeons used to do this surgery in about 2.5 hours. Ever since using the HoloLens and just being able to pinpoint where the tumor is and plan his port insertions, he's brought it down to about 45 minutes to 1 hour.
Wow.
Yeah, so in terms of patient safety, anesthetic time, time to recovery and surgical ergonomics, these are essentially areas that we are seeing direct benefits. And indirect benefits, it means that if we shorten the operating time, we can put more operations into a single day. So instead of perhaps maybe 3 adrenalectomies, I can do 4 now, right? So that long-term effect is that we can shorten patients' waiting time for surgery, and we can maximize the use of the operating theater. And I think that is the indirect sort of financial returns of investment that we're getting from technology platforms like this. Yeah.
Well, this is brilliant, Dr. Gao. Thank you very much for explaining all that. We will maybe deep in another session, but today during the mobile, we have short interviews. But thank you very much for showing your experience.
Thank you.
And we hope that you can disseminate all these programs around the world.
Yes.
Thank you, Dr. Gao.
Thank you. Thank you.